Thanks for joining us on This Week in Health IT. This is a solution showcase. My name is Bill Russell, former healthcare CIO for a 16-hospital system and the creator of This Week in Health IT, a channel dedicated to keeping health IT staff current and engaged. All right, today we have a solution showcase, and we're going to talk about some really cool advanced technologies in healthcare that is transforming healthcare. We have Chris Gough with Intel, Dr. Sanaz Cordes with Worldwide Technology, and Dr. Eric Quiñones with Worldwide Technology as well. I want to thank WWT and Intel for sponsoring this solution showcase. It's a great conversation, a lot of really cool solutions they've come up with for healthcare. If you want to learn more about this, you can hit the website, wwt.com. They have a lot of really great material for healthcare professionals out there. If you want to be a part of our mission, you can become a show sponsor as well. The first step is to send an email to partner@thisweekinhealthit.com. Your response to ClipNotes has been incredible, and why wouldn't it be? You helped create it. ClipNotes is an email we send out 24 hours after each episode airs, and it has a summary of what we talked about. It has bullet points of the key moments in the show, and it has 1 to 4 video clips. So you can just click on those video clips and watch different segments that our team pulls out that we think really captures the essence of the conversation. It's simple to sign up. You just go to thisweekhealth.com, click on subscribe, put your information in there, and you'll start receiving clip notes after our next episode airs. It's a great way for you to stay current. It's a great way for your team to get to stay current, and a great, really, foundation for you and your team to have conversations. So go ahead and get signed up, get your team signed up, and begin getting clip notes after the next episode. Today we have a solution showcase. We have Chris Gough with Intel, Dr. Sanaz Cordes with WWT, and Dr. Eric Quiñones with Worldwide Technology as well. Good afternoon, everyone, and welcome to the show.
Thank you, Bill.
Thank you. Pleasure to be here. Yeah, I'm looking forward to this conversation. There's an awful lot of talk right now around the locus of care and the shift during the pandemic to remote care venues and really into the home. And we're seeing some of the payment models start to follow that. So let's start with this question. What kind of challenges come along with that change? And what kind of challenges does this represent to healthcare and to health IT organizations? So we'll start with you, Dr. Cordes. What are your thoughts about the change in the locus of care?
I think that there's sort of the tactical logistic challenges, but there's also the mindset, the philosophy of really shifting the way health systems think about care, as typically it's been episodic and reactive care, right? Patients come in and access care at points in time, and then we react to it, to this model of continuous proactive care. I think that's what the pandemic has shown us. It's really important to be able to kind of make that shift, and doing it remotely and being at home is truly the best way to capture that sort of continuous data and find out information before it becomes a challenge and you need to intervene medically. And then I think from sort of just day-to-day execution of that, the access to the care, beginning with just the digital engagement. Do they have a portal set up properly? Can patients have that retail sort of experience that they expect to be able to get on, schedule, launch their remote engagement, have their devices at home feed in seamlessly? And then the connectivity. We serve a lot of health systems at Worldwide that have rural locations or various communities that don't necessarily have access to Wi-Fi or devices that can allow them to have some of this care. So making sure that they can do what they can to solve for that. And sometimes that involves things like putting up stations in communities, libraries, and things like that, which we're helping folks do to be able to come in and access telemedicine. And then, of course, for the CISOs of the CIOs and all the folks on the IT side of the organization, the data, getting the data, aggregating the data, putting the data in the right place, and the security around doing that as more and more devices become part of the remote plan, making sure that patient information is passed through securely. So
as a follow-on to that, do you think this is going to be a permanent shift that, really was accelerated through the pandemic? We saw this happening prior to the pandemic, but as the pandemic has sort of accelerated it, do you think it's going to continue at this kind of pace following the pandemic?
I do think so. I think we're sort of in a different phase now where that kind of rush to have a lot of telemedicine visits and completely not coming to the hospital, as we all know. That's kind of, we're past that and people are feeling safe and coming back in. But I do think that these new models of care are here to stay and will probably continue to grow. I think some of the industry changes suggest that CMS is providing more and more reimbursement and programs for hospital at home. There's grants that continue to, pop up around this. So I do think that it's here to stay, and it's going to continue to evolve. And we're probably going to see version, 3.0 roll out in 2022. And I'm excited to see what that might look like.
Yeah, me too. So Dr. Quiñones, so let's talk a little bit about the use cases. What are some of those use cases which are moving to the home that have a need for real-time data and real-time interaction?
Yeah, right. I think Dr. Cordes actually touched on a few, but particular to CMS, they have the acute hospital care at home program, which is an expansion of the CMS Hospital Without Walls, launched in March 2020. So the immediate goals of that was to really allow experienced hospitals to quickly expand care to their Medicare beneficiaries, as well as the hospitals themselves are required to submit this monitored data on a per month basis. So that's one prong, or one thing I see. Another thing is that at the end of February, I believe, Humana's Medicare Advantage population will have in-network access to Mercy Virtual, which is the hospital without beds out in St. Louis. So it's staffed with greater than 300 clinicians providing proactive remote patient monitoring for patients at home in the hospital setting as well, that are being monitored again by Mercy Virtual. And this is really a value-based care play with Humana for their patients in, I believe it's Arkansas, Kansas, Missouri, and Oklahoma as well. And then lastly, I would say on one of the non-traditionals, so big tech, you have Amazon Care, but not alone, with Intermountain Health and Ascension Health that are founding members of the coalition. And they're really have been driving and lobbying to make permanent changes to the home care health reimbursement policies. So that's very huge. But they also have additional members. That's Moving Health Home initiative. I think Landmark Health, Amwell, Signify Health, and several others. So there's a lot of forces that are driving these initiatives to Moving Health Home.
I think today, if you look at just simple doctor-patient virtual visits or remote patient monitoring in the home for chronic diseases, as Dr. Cordes said, those require kind of discrete measurements, maybe a few times a day. As these acute services shift into the home over time, we think there's going to be a need for more streaming telemetry and continuous data. So that will cause some additional challenges and technical requirements to accommodate those that different kind of data acquisition in the home.
Yeah, and that's the direction I want to go. It's interesting that you said a hospital without beds. It actually has beds. There are beds, right? There are beds at home. As a CIO, I used to get asked all the time, how many beds does your hospital have? And I guess for Mercy, they have to say this many acute, but they also have to say, this many people are being monitored from our virtual hospital in their own beds, really. So it's kind of interesting. But
right.
So along the lines of what Chris was talking about, what kind of conditions are we seeing sort of emerge at this point that people are using this kind of real-time data, real-time tracking, and delivering that to a care team so that they can provide care for that population?
Well, I think initially one can try to boil the ocean and try to look at all chronic conditions. That might be a little too much. If you focus on what we're seeing, or what I've seen, is focusing on those chronic care conditions that we spend a lot of money on, or there's a lot of opportunity there to be more proactive with that population. Those are the kinds of conditions that I see this really getting in front of. So for example, congestive heart failure, diabetes, hypertension, and things like that. Things that are some of the most common conditions we see that we're spending our most dollars on in healthcare to be proactive with those patients and taking corrective action before they end up getting in a bad place and having to be whisked off to the ED. Those are the kinds of conditions that I've seen.
Chris, I want to come back to you. Microsoft and Intel engaged WWT to develop a hybrid cloud solution to demonstrate the power of the Azure Stack Edge Pro's edge compute and AI technology. Tell us a little bit about that project.
Yeah, sure. Well, as we've engaged with healthcare organizations, we have seen a common need for like an intelligent edge solution. There's always going to be an edge in healthcare. That's where the patients are. That's where data is originally acquired. And there's some applications or use cases that really are more appropriate to be deployed in that physical location. So that could be driven by latency. So for example, if you're looking at a large imaging study and you want to do some image analytics to find a feature in that data, you want to make a decision there at the point of care quickly. You don't want to send the data to the cloud, process it, send the answer back. Video is another good example of that, where you don't want to send for cost and complexity and speed, like raw video streams to analyze that kind of data. And then also from a regulatory perspective, depending on what country, state, or province you might be in, there's different rules for how the data is regulated and where it can reside, where it can be processed. So for all those reasons, like a hybrid, we feel like a hybrid cloud solution lets the healthcare organization run certain applications or workloads there, at the edge, at the point of care. And it could be like, for example, fall prevention, analyzing video. We see that use case quite a bit. And then for applications that are more suitable for the cloud, like maybe a longitudinal, population-wide study, more of a health research use case, they can decide to run that there. So the hybrid cloud solution really lets the organization decide based on the requirements of that particular application or workload. Do I want to run this on the edge at the point of care? Do I want to run this in the cloud? And that flexibility is appreciated.
Absolutely. So many health, and Dr. Q, I want you to comment on this. Many health organizations are stuck on the challenge of compliance, privacy, latency, and really getting the right data into the hands of the physician without overwhelming them. How does a solution like this address these challenges?
Sure. Simply put, this helps in identifying the signals from within the noise. Clinicians are slammed and they're just overwhelmed with the amounts of data that is, humanly impossible to manage. It's sheer cognitive overload by numbers. Tools like this get the right data about the right patient to the right clinicians at the right time in order to be proactive and to be supportive in their critical clinical workflows. A tool like this can be configured, for chronic care management populations, post-discharge care populations, behavioral health, even rapid response teams that are in the hospital that are responsible for surveillance of acute care populations. Most rapid response teams are activated after the fact, after something bad has happened. So tools like this can definitely help in real time triage patients and get them admitted to the right place in the hospital. An example of that would be a patient being admitted, to the floor for observation from the ED. Many times there's a changing disposition with a patient like this because they're waiting, for a bed for a long period of time. Having a tool like this to be able to bring these insights to the forefront so clinicians can make adjustments and make sure the patient gets transferred to the right level of care, perhaps the ICU, is very important. And these are things that we need today to really change the outcomes. But time is everything. Early recognition of patient decompensation, driving early intervention leads to better outcomes and cost. And all this can be done using the organization's clinical protocols, and even developing advanced analytics models that are tweaked by the organization's governing bodies that provide even higher positive predictive value and negative predictive value at the individual patient level.
Dr. Cordes, I had to laugh when I was reading about this. I love the challenge that Worldwide Technology was given. January of 2021, they were given this challenge: deliver a fully functional proof of concept by the end of February for the Microsoft Ignite conference in early March. Talk about how that is even possible.
There's nothing we love more than a deadline challenge worldwide. Yeah, no, it was phenomenal to watch the team in action. I mean, we have such a diverse team. We're really fortunate to be able to just quickly assemble the right folks. So we were able to bring physicians with practice experience, like Dr. Quiñones, myself, physicians and nurses who have health tech experiences, who deeply understand how the electronic workflows work. Where does information need to go? What needs to, as Dr. Q was saying, what notifications go where, et cetera. We have data scientists. We have dozens of PhD data scientists on board. We have AI ML experts, our software developers. We have UX designers, product managers. So we were able to quickly assemble this group, this really great team, to start working in a sort of an iterative model to identify the use cases, vet them, have really great collaborative discussions. And, what Worldwide, our application services team, we have agile methodology to see that in action and see how valuable that is to be able to roll things out this quickly. I think this project really brought that to light. So yeah, we did it. We were able to kind of roll that out. And we also were able to tap into some of our customers. We at Worldwide touch 1 in 5 patients in the US when you look at our reach of our health system customers. So I actually was able to meet, and I think Dr. Quiñones, you might have as well, met with a couple of our health system organizations, CMIOs and others to get some feedback along the way, which was really helpful.
Give us an idea of what was developed. So clearly you didn't develop it for all chronic conditions. It was probably focused on one, given that time frame. What was actually developed and what did it showcase?
So first of all, clinically, the use case that we landed on was heart failure. Heart failure is the costliest condition in the US to care for. I think $70 billion a year spent, the number 1 cause of death in the US. So we sorted through several chronic diseases, and that one made sense clinically. And also, as we looked at what's a data-rich environment for someone potentially at home. And of course, this solution can work in a lot of other settings, and we can touch on that. That's not just at home, but in this first model, a data-rich environment, a heart failure patient may be able to, we would be able to monitor multiple devices like blood pressure cuff and scales and pulse oximeters and EKGs. So it made sense that this would be a good starting point use case. And so starting with that, we were able to create protocols, and Dr. Quiñones led most of that effort using practice guidelines and things through evidence-based medicine to sort of create the protocols of what it would look like as we monitor a patient at home, the normal, abnormal, and what's the beauty of this solution, abnormally trending normal, which you don't normally get to do when you're doing point in time data collection. So when a patient comes in, you're just seeing their blood pressure when they're there, and it's probably high because they're dealing with white coats and the stress of being at a doctor's office. And so creating, the solution so that the AI and machine learning could then come in and say, well, when the pulse ox is still normal, but it's trending this much below where it was the last 5 days, and the scale indicates a slight weight gain that's still normal, and you marry that with X, Y, and Z, now we are getting some data-rich insights, and now we can take proactive steps. And so that was all kind of put in place. And then from an actual user interface perspective, we had a very beautiful design that our app services team created that was sort of the red, yellow, green model of showing trends and then being able to actually show notifications. And it was a great dashboard that was configurable to what physicians would want to use, or case managers, or anybody that would be accessing the information. And that was the initial sort of prototype that we rolled out for the Ignite conference.
Fantastic. So Dr. Q, what potential outcomes for care, as Dr. Cordes was talking, you can apply this at the home, but you could also apply it within other care settings. What kind of outcomes for care do you anticipate as a result of this type of solution?
I think taking a step back a little bit and thinking about where it actually helps, right? So if we think of a solution like this, really helps us scale, and it helps us to have greater optics for the patient and the population's longitudinal journey. Clinical resources are thin right now. We see the numbers that are entering med school they're starting to increase a little bit, but still you can't, train a doctor overnight or nurses overnight. It takes time. The AAMC, I think, said last year at some time, noted that shortages between 21,000 to 55,000 for primary care physicians, and I think somewhere around 34,000 to 87,000 for surgical and medical specialty positions by the year 2033. So that's really significant. And then with the U.S. population that's getting older, that's just more chronic conditions that we have to care for. So we need advanced technology solutions like this to help bridge that gap. And integrating, multiple data points, not just the data points that Dr. Cordes, talked about, but as data points become greater, not just vitals labs, but very wearables, the genome, social determinants of health, environmental and ecological data. This all drives us down that proverbial precision medicine road that we're all striving for. And I think this can have a tremendous impact on cost, outcomes, patient satisfaction, and clinician experience for sure. With this level of data, it can also help drive the acceleration of research in life science. So there's a lot of outcomes that I think that are going to be coming from this.
This is a great example of a partnership between Intel and WWT. How can people really tap into the solution? If people are interested in this, how can they find out more information?
Yeah, they can absolutely find out more. They can reach out to anybody on this podcast right now, Chris, Eric, myself. We also are in the Microsoft Marketplace. So there's a engagement there that folks can review and click on and sign up for, where we can help them with learning more about the solution and customizing it, and ultimately potentially rolling it out for their use cases.
I was looking at another use case that you guys have on your website, and I want to talk about it a little bit as we come to the end of the podcast. But it's really interesting, and I think it also accentuates your partnership. And that's the machine learning in radiation oncology at WashU School of Medicine. Who wants to give us some background on that project? It looks really fascinating.
Worldwide Technology, we collaborated with Washington University School of Medicine in St. Louis to utilize machine learning to really develop methods to predict radiation treatments for patients with cancer. About 1/2 of all cancer patients receive radiation therapy as part of their treatment plan. And radiation oncologists coordinate with oncology specialists to review appropriate treatments for their patients, what we call multidisciplinary tumor boards. They use national and international guidelines, patient history, details of that patient history, and physician clinical experience with various treatments, and available resources that they have at their facilities. The radiation or radiology oncology treatments have become much more complex as a result of all this. Precision of this type of treatment is really critical and needs to be unique to the patient. Radiation not only kills cancer, but it also kills healthy tissue as well. So there's no room for delays in treatment. Time is critical. So this led to Washington University and Worldwide Technology working together using high fidelity diagnostics, clinical and treatment data to author machine learning algorithms that quickly predict the optimal radiation oncology treatment orders for head, neck, and lung and prostate cancer. Using this platform, radiation oncologists specialists specify, the details of the cancer, and they specify the details of the cancer of the patient, and then as a result, the machine learning algorithm is given the radiotherapy planning, target volume, the frequency of treatment, the prediction percent, with explanation, which is very important for the clinician, the patient body positioning during treatment sessions. All these things are super important, and the type and frequency of radiology imaging needed. So that all takes a lot of time. And so this really has a potential to expedite a time-consuming process in radiology oncology orders, with the goal of greater efficiency as well. Also, I believe Washington U School of Medicine is authoring an academic paper on this. So we're really excited to see what comes of this amazing collaboration and technology.
Chris, as I listen to this, the precision aspect of this, getting to the N of one, as they say, this kind of precision, these kind of things create massive workloads, and they're compute intensive, they're storage intensive. I mean, the processing obviously is significant. What advances has Intel made to handle these kinds of workloads, and what can we expect moving forward in this area? This is exciting stuff to get closer and closer to that promise of precision medicine.
Yeah, absolutely. We work very closely with the healthcare ecosystem, both the partners that bring solutions to market, but also with what we call the end users of our technology, hospital systems, pharmaceutical companies, et cetera, so we can understand their requirements. We, in the case of what we're talking about today, understand how they use or could use machine learning to improve what they're doing. And we'll weave those requirements right into our technology that we're bringing to market. So we're known as a CPU company. We actually have an XPU strategy. So depending on what kind of artificial intelligence it is or what kind of machine learning it is, there could be different hardware that's more appropriate for that task. And then beyond the hardware, working with the software ecosystem to optimize all that software to make sure it's as scalable and efficient as it can be, and as it's taking advantage of all the underlying features. And then, of course, working very closely with partners like WWT and Microsoft to weave that innovation into the solution, like the solution we talked about today, so that from the end user's perspective, it's sort of invisible. It just works, high performance, and it can accommodate the machine learning task, whatever task is put to it. So,
yeah. So, Dr. Cordes, anytime we talk about machine learning, anytime we talk about artificial intelligence, I wander back to some of the conversations I've had with physicians, and there's still a reticence by some physicians to adopt this kind of stuff. How do physicians view this and the use of this technology, and what's going to take it forward, do you think?
It's interesting. I started my health tech career in clinical decision support when I stopped practicing and I moved over to the corporate space. I worked for an organization where we sold just static order sets, just CPOE order sets in the early 2000s. And that started my journey of managing physician cultural adoption. And it's really interesting to look back now, 15 years later or 16 years later, and we're still doing that, right? I mean, if you asked a physician now, like, how do you feel about just a passive asthma order set or CP? They'd say, yeah, of course, I've been using that for over a decade. But at the time, it was very challenging, right, to get this adopted and become part of the workflow. And so I think we're just same story, fifth verse now as we see more and more AI and ML, and it becomes more commonplace and more organizations are bringing it on board. So there's nothing magical. It's just the same kind of formula. We need to make sure that whatever solutions we bring forth, in this case, AI and ML, that we're able to demonstrate a solid clinical ROI, because that matters more than anything to the physician. So having those success metrics in place. So with the case study that like Dr. Quiñones just described with radiomics, being able to point back and say, with a 97% accuracy, this, and this was identified in these 200 patients. And by measurement, their length of stay or any other adverse outcome was decreased by X%. And so I think that we know that now, right? Like two decades into it, you really need to present that to clinicians. And so I think health systems should keep that in mind as they roll out solutions, putting in those metrics and a plan to measure them. And then I think engaging stakeholders early and often, bringing physicians to the table, making sure that their voice is heard and that they can help become part of the process and become sort of invested in it, I think is really important. So it's nothing magical. I think it's just what we've been doing over the years. And I guess the third thing that helps is there are the folks that are early adopters. They embrace change. They want these solutions. And so getting them to be advocates to their peers has always been really helpful to me, bringing solutions to organizations. And so, yeah, I think a combination of those things, and we just keep learning from what we've done in health tech over the years and growing on it.
We found that when you're rolling out new technology, like say, like a machine learning model that's going to predict patient risk for some type of condition, if it can be done in such a way that it minimizes the disruption to the current clinical workflow, like maybe putting that risk score right in the electronic health record, as opposed to requiring the clinician to interact with some second application, that also can help with adoption and receptiveness quite a bit.
Chris, that is such an important point. Absolutely. Physicians, nurses, clinicians spend 10, 12 hours a day in the EHR. That is their user interface. The thing I've learned over the decades is, yeah, they absolutely don't want to open 7 other apps. They do not want to have multiple user interfaces. And so being workflow congruent is absolutely crucial. So great catch on that.
We've talked about how people can get more information on these solutions, but as a former CIO, I'm sitting here thinking, what if I had an idea? What if our health system had an idea? Is this the kind of thing that we could tap into you guys and say, look, we've got this problem, we've got this challenge, we're thinking of this. Could we give you the same kind of challenge saying, hey, it's January and by March, we need to roll out a solution around this?
Absolutely. We have 500 engineers, we have several dozen PhD data scientists, and when they're not involved on an active engagement, which doesn't happen often, but when it does, we have a very robust R&D mentality at Worldwide. And so we have actually done recently a lot of work around computer vision, reverse image lookup in the MRI brain tumor space. And that was all based on kind of what you just described, Bill, where we had a health system express interest in that and ask questions about it. And we brought that back to the organization, and those guys just took it and ran in the AI ML team, our business analytics team, and we're able to, build the solution. And so we are always excited to discuss solutions and then work with our customers. And again, we can reach out to Eric or myself or anyone at Worldwide in our organization to learn more about that.
And one more point to Dr. Cordes' comments. So at Worldwide Technology, we have a platform that really helps expedite this stuff. So the advanced technology platform, I think the initial investment was about $500 million with our OEM partners, such as Intel and others, that they have the ultimate sandbox, if you will. So a health system can duplicate their environment within the ATC. And if they're planning to bring on new technologies, they can do that, or they're going to do data migrations or any core IT infrastructure changes and things like that. They can do it quickly, with an agile mentality to be able to come out with an outcome and help them with the decision. So that just saves time and money.
Fantastic. And they can get more information at wwt.com.
Yes.
I'm excited about this. I'm glad you guys came on to talk about this. I mean, these two solutions are interesting in and of themselves, but I love the fact that we can brainstorm together, that we can get into a room with data scientists, engineers, just
the different partners, Intel and others, and come up with solutions. And that's what it's going to take. It's going to take that creativity of the group getting together and bringing our skills together to come up with new ways. I think the pandemic taught us that we can do things that we didn't think were possible before. I hope that pace of innovation continues. So thank you very much for coming on the show. I really appreciate your time.
What a great discussion. If you know of someone that might benefit from our channel, from these kinds of discussions, please forward them a note. Perhaps your team, your staff. I know if I were a CIO today, I would have every one of my team members listening to this show. It's conference level value every week. They can subscribe on our website, thisweekhealth.com, or they can go wherever you listen to podcasts, Apple, Google, Overcast, which is what I use, Spotify, Stitcher, you name it, we're out there. They can find us. Go ahead, subscribe today, send a note to someone, and have them subscribe as well. We want to thank our channel sponsors who are investing in our mission to develop the next generation of health IT leaders. Those are VMware, Hillrom, Starbridge Advisors, Aruba, and McAfee. Thanks for listening. That's all for now.